We are talking about the epileptic seizures or the disease of the epilepsy in the individuals, which is basically characterized by the seizure, which is not associated with any recent past history of trauma or any other medical condition that the patient is suffering from. So, this is how we go about and define this condition, which is known as epilepsy. There is a range of variants, as in people who are suffering from these condition, which is known as epilepsy, ranging from the grand mal epilepsy, which is basically characterized by the generalized tonic-clonic seizures. Then we have the absent seizures in the individuals, which is characterized by the petit mal epilepsy in the individuals. We have people who are suffering from the partial seizures or the complex partial seizures in the individuals. So even if the patient doesn't suffer from a seizural attack or a particular complex seizure, he or she may behave abnormally. In a lot of cases, the patient comes up with complaints of abnormal sensations or the loss of awareness or the loss of consciousness. Is also characterized as to be having the epileptic seizure. So these are the different variants of seizures that are seen in the individuals suffering from epilepsy. So over here in this section, we'll be focusing on the different sorts or the different types of epilepsies and what are the clinical presentations in each of these types. How can we go about and classify this epileptic syndrome? Obviously, the treatment modalities and the further management that lies upon the initial diagnosis. So it's again very important to diagnose these cases correctly and differentiate them from any psychotic symptoms or any psychiatric illness that are not of the neurological type or that are not because of the central nervous system involving or including them. So that is what we're going to discuss over here. Their clinical presentations will be discussed in detail. We'll be discussing first of all the grand mal epilepsy. As I've already emphasized, there are basically the generalized tonic-clonic seizures, which are the most typical picture of the seizures that is noted down in the individuals. Then we have the petit mal epilepsy that is sometimes seen in the individuals, and it is characterized by a certain sort of a complex seizure. It can be the absent seizures that are noted down in these individuals. Atypical kind of seizures are seen in these individuals. Then we have the complex partial seizures that are also noted down in a lot of cases, and one should know how to distinguish or differentiate between all of these variants of epilepsies or all of these variants of these seizure types noted down in these individuals. Grand mal epilepsy is also known as tonic-clonic seizures. What happens over here is that there is the loss of consciousness observed in these individuals, fall and stiffening of the limbs is observed in these individuals. There is a rhythmic shaking phenomena also seen in these individuals. Breathing may stop temporarily. When we say tonic-clonic seizures, it's basically a group of muscles tones up and then a group of the second muscles clones up accordingly. So that is basically characterized by the tonic-clonic seizures, in which we have a group of muscles relaxing at one time and at the other time we have them in the tonic or in the tonicity stage. So this is the seizure that is usually seen in these individuals. The breathing may stop temporarily in these individuals, and that is again an emergency. The lack of supply to the oxygen, the lack of blood supply and the lack of the oxygen supply to the brain is again more damaging to the brain and to the central nervous system. Skin, nails and lips may turn blue. The loss of bladder bowel control may occur in these individuals, and that results in the urinary incontinence or in the stool incontinence in these individuals. Tongue bite is again one of the phenomena that is also seen in these individuals. And then we have it usually the time duration for this generalized tonic-clonic seizures. It lasts for almost 1 to 3 minutes and is followed by confusion and sleepiness. So this is the whole seizural or the ictal phase that is observed in these individuals. Usually it is very tiring for the individual. The energy consumed during this tonic-clonic seizures is very high. So that is why after this seizural attack, the patient usually feels quite fatigued and he goes to sleep and he's in a state of confusion. So that is the clinical presentation, or that is the typical clinical picture seen in these individuals having that seizural attack during this grand mal epilepsy, or the people who are suffering from the tonic-clonic seizures type of epilepsy. Then we have the partial seizures. In a partial seizure, the electrical disruption involves a limited area of the brain, and that is again very important to have a look at. Only a limited area is involved. What happens during a seizural attack? What we have to observe on an EEG, that is the electroencephalogram, is again very important. There is an increased or an amplified electrical brain activity that is again resulting into that typical tonic-clonic seizure, or that typical abnormal behavior that is seen in that individual. Then we have the simple partial seizures that are sometimes observed, a seizure activity in the brain causing the rhythmic movements, and the isolated twitching of the arms, face, and leg is also observed in these individuals. Sensory symptoms, they include the tingling, weakness, sounds, and smell. So these are the abnormal sensory sensations that we've already talked about. It's not always the seizure that is seen in these individuals. The typical picture can become atypical at any moment, and the taste, feels of upset in the stomach is also observed in a lot of individuals. Then we have the visual distortions. So it can be the blurring of the vision, hallucinations, delusions. All of these are a part of the pre-ictal phase sometimes, and sometimes they're a part of the post-ictal phase in these individuals. Then we have the psychic symptoms that are also observed in these individuals, and they range from the hallucinations, as well as the person can have the delusions of certain kind. The hallucinations can range from the tactile, from the visual, as well as the auditory hallucinations are observed in these individuals. And then we have the feelings of fear or anxiety is also observed in these individuals suffering from the simple partial seizures. So usually there is not that typical picture of seizure observed in these individuals. They have sometimes the twitching sensations, they have the sensory symptoms of the abnormal kind, and then they can also suffer from the psychic symptoms in a lot of cases. Usually they last less than a minute and may precede the generalized seizures. The complex partial seizures, the confusion, inability to respond, and automatic purposeless behaviors are observed in these individuals. Picking at clothes, chewing, mumbling is observed in these individuals, may be confused with drunkenness or drug use, and willful belligerence or aggressiveness is also seen in these individuals. It is characterized by the altered awareness. Emotional outbursts are also quite common in people who are suffering from the complex partial seizures. Then we have the complex partial seizures. What are the associated features of these complex partial seizures? How does the epilepsy disrupt the normal brain anatomy? How is the brain anatomy affected by the severity, recurrence, secondarily generalized, or in epilepsy? Genetic underpinnings of the structural brain changes in the epilepsy are again very important. So these are the questions to be put forth to the patient or to the family of the patient. It's again very important. So in this section, basically, we focused on the different kinds of the epilepsy, or the different variants of the epilepsy, and how do we go about and look at the clinical pictures of these different sorts of epilepsies. So that is the end of this section. Thank you for watching sqadia.com.